During ejaculation, sperm pass through the ductus deferens into the urethra, and along the way, they're joined by fluids from these three accessory glands. On this lateral view of this structure, on the posterior face of the bladder, is one of the seminal vesicles, although you do have two because they come in a pair. This is the prostate right here, which is surrounding the urethra. And then this sphere-shaped little gland right here is called the bulbourethral gland. Once all of the fluids from these accessory glands mix together with the sperm, then we call the final product semen or seminal fluid. Only about 20% of semen is sperm. In that small proportion, there can be 50 to 120 million sperm per milliliter of fluid. So less than 25 million sperm per milliliter is considered infertility. The seminal vesicles, which are right here on this posterior view of male reproductive organs, they contribute about 65 to 75% of the seminal fluid. The seminal vesicles contribute fructose and citrate, which is converted by the ATP in the mitochondria in the midpiece of the sperm. They also contribute prostaglandins, which can stimulate smooth muscle contractions in both male and female reproductive systems. But prostaglandins also inhibit the attack of female immunoglobulins on the sperm. Seminal vesicles create something called semeglobin. This adds viscosity to the semen, preventing drainage from the vagina. About 20 to 30 minutes post-ejaculation, the prostate-specific antigen, or PSA, it liquefies the semen. We use PSA levels to screen for prostate cancer. If they're high, then the prostate is overfunctioning. The prostate gland completely surrounds the urethra, as shown in this inset picture here. This gland, which swells later in life as testosterone drops, it contributes about 20 to 30% of the contents of semen. Semeglobin made by the seminal vesicle is activated by an enzyme from the prostate called presemeglobin. And the prostate, as you can see from these histological pictures, has lots of secretory vesicles, which is characteristic of all three of these accessory organs. And finally, these bulbourethral glands. These release what is called a pre-ejaculatory fluid. And this contains buffers, mostly bicarbonate and phosphate, to neutralize the acidity of the vagina.